caused by something called like a bad omen or a curse or a punishment. This is for thousands of years. And what ended up happening was even Hippocrates, who was the father of Western medicine, coined the term apoplexy, meaning struck down by lightning. So anyone who has this kind of paralytic affliction, it was attributed to they must have done some kind of crime or punishment, and God is punishing them, so they had a stroke. This was not just in Greece, it was ancients all over. This was even in the Bible. It was described as when the Jews were leaving Jerusalem, when Babylonians take over, in the Psalms, they sung the song, if you forget this holy land of Israel, your tongue won't work and you won't be able to use the right side of our body, which we know is an MCA stroke now, but this was it's in the Bible, it's a Holy Spirit description. This is all the way from even north to South India, everyone believed some curse or some bad omen. It wasn't until 1640 when a gentleman by the name of Jacob Leffner, a pathologist, looked in the brain of these stroke patients and was able to say, hey, there's something in this brain where this person had right-sided weakness or left-sided weakness with right-sided lesion, where they thought, oh, this is not apoplexy, this is something else. This is something, a brain disease causing this problem. From then, we started to understand, keep studying these brains, keep studying these mechanisms up until the early 1900s, and a doctor by the name of C. Miller Fisher started localizing the stroke better, causing stroke syndromes like the pure motor syndrome we saw. There's also like, ataxia, hemiparesis, clumsy hand dysarthria, so many stroke syndromes. What ends up happening is that we end up figuring out different mechanisms, which what you saw today was we're breaking down mechanisms, carotid disease, heart disease, different mechanisms, so many textbooks on stroke. Up until only 1995, we developed the first thrombolytic treatment for stroke. So imagine human history, no treatment for stroke. We're giving IV fluids, we're trying heparin, we're trying physical therapy, we're just nothing for patients who had stroke. They just live with their stroke. But now we're able to do the most intuitive strategy, which is recanalization. The second thing, thrombectomy, just became approved. Just like in my generation, training recently, just the last 10 years, we're starting to do more and more than the recent Dawn and Diffuse trials in extended time windows just the last 4 years. So human history